lately, we've been hearing this term shared decision making, which basically means that patients and clinicians collaborate to make healthcare decisions. And it can help patients to take a more active role in their care. I'd like to get your thoughts, Dr. Fonseca, on how best to make this process work.
You know, we are very fortunate to live in this time of medicine where ultimately we recognize that the patient is the person expert, and it is the patient decisions that should drive what is to be done in a situation. So whenever I interact with patients, I tell them, listen, I'm going to be like your counselor. I will provide you with options of what I think is reasonable. And I will go to different degrees of effort in trying to convince you one way or another for a particular intervention. But at the end of the day, I only do a good job if I present you with the options and the pros and cons of those various approaches. And I weave that into my language on every single conversation we have with patients. I think we're way past the time where, you know, a physician would come and say, this is what you're going to do, or this is what will happen. You know, my language always includes, you know, I would recommend this. I think the next best step for you to consider would be X, Y, or Z. But ultimately, I look at patients and not infrequently at the person next to them, you know, a family member or a close friend. And I say, you know, you're the boss, and, you know, with the person next to you, you know, providing additional support, comment, and guidance, we can together reach the best decision of what should proceed. And I think we're incredibly fortunate because, you know, patients have access to sophisticated information, especially patients that have serious conditions such as would be cancer, and in my case, myeloma. And as an example, when I work with residents, you know, general internal medicine residents that work with me, learning about hematology, I sometimes tell them, you know, you want to walk into a room. Are you going to be seeing what I say? This is like a tennis match between professionals. Are you going to see the level of questions that patients are going to be asking me? And they're going to be asking me about the latest study that was presented at this meeting and the p-value and, you know, this and that. And I can guarantee you that you would not have the tools to be able to address all those questions simply because there's such a, you know, in-depth understanding of the disease. Now, I realize this is not everyone. I'm giving you an extreme example. There's individuals that need additional support, more resources. But just to interact with someone who has such commitment to understand their disease and to help us by that understanding make the right decision makes my job so much more rewarding.
Well, what do you think is the role of a patient then in their care?
You know, I think it needs to be describing in some detail, and there's a lot to unpack there. Of course, you know, patients are dealing with a very serious diagnosis, and it's okay to have periods where they are, you know, in a pause moment and they're reflecting of what they're facing, and that they can gather information from close family members. I think we as providers and the medical team needs to deliver a message that provides clear options for them as far as what the best next phase of their treatment or their management might be, including observations or supportive care. But, you know, the patient ultimately is a person who has to make that decision. I frequently get the question, and this is not surprising, and, you know, it happens all the time. And, you know, patient tells me, well, what would you do if this was a family member? And I always tell them, I always talk to you as if you were my family member, as if you were my brother, my mother, my father, so that, you know, I try to live deeply to that, you know, fiduciary responsibility I have to your well-being. I recognize that there are circumstances, and, you know, that's part of the finesse and the art of medicine, that I have to help a little bit more, walk you through that step. And sometimes it's just human that one may want to say, I just want to disconnect. Maybe I'm not the person that wants to go and read in detail, but perhaps I have my daughter or my son who are helping me and understand better where things are. I think one of the key aspects of my role is to make sure that I have a sense that the person has a good understanding to be able to make an informed decision. And at the end of it all, you know, if the person decides to proceed in such a way that doesn't necessarily align with what I'm trying to do, I'm deeply respectful of that choice. Now, I will go to extra lengths. So if someone is foregoing treatment, when I know their treatment has a high likelihood of improving their quality of life, relieve a symptom, or improve survival, I don't think I would do a good job if I don't present why that's so important. But ultimately, it is a patient's decision.